Early signs of Lyme disease. The first symptoms to watch for. Lyme disease is far easier to treat when it is caught early, yet the first symptoms are so ordinary that they are constantly mistaken for a passing virus. Knowing what to watch for in the days and weeks after possible tick exposure can make the difference between a straightforward recovery and months of unexplained illness. Why early Lyme is so easy to miss. The bacteria that cause Lyme are transmitted by the bite of an infected black-legged deer tick. Because the bite is painless and the tick can be tiny, many people never recall being bitten. The earliest symptoms then look like a summer cold or the flu, so both patients and clinicians can easily point the finger elsewhere. The first symptoms to watch for. Early Lyme disease usually begins within days to a few weeks of the bite. Common early signs include fatigue that feels out of proportion to your activity, fever and chills, headache, muscle and joint aches, sometimes moving from place to place, swollen lymph nodes. The erythema migrans rash. Though not everyone gets one, here is what the Lyme rash actually looks like. A telling feature is flu-like illness without the usual cough, congestion, or runny nose. A summer flu that hits during tick season deserves a second look. Symptoms of early disseminated Lyme. If early infection is not treated, it can spread over the following weeks. This stage can bring additional warning signs such as multiple rashes on different parts of the body, facial drooping on one or both sides, facial palsy, nerve pain, numbness, or tingling, heart palpitations or an irregular heartbeat, episodes of dizziness or shortness of breath. These are signals to seek care without delay. When to see a doctor. If you develop these symptoms after spending time in wooded, grassy, or brushy areas, mention the possibility of Lyme to your physician directly. Early testing has limitations, so your history and symptoms matter as much as any single lab result. Here is why Lyme tests sometimes come back negative. The earlier Lyme is addressed, the better the outlook. Visit the link in the description below for more information.